I'm Cory Busey. I'm the Vice President of Client Success and Healthcare Engagement Strategy at Acario. So thank you for being here, and welcome to all of you, and welcome primarily to our panelists this morning. Excited to talk with this group. I've had a chance to do a couple of precursor conversations with this group, and I think if you have half as much fun listening to this conversation as we've had having it in the last couple of conversations, I think you're in for a treat. So joining me this morning on stage is, starting from our far left, my left, your right, is Liz Canis, Healthcare Executive and Board Director and Advisor. Welcome, Liz.
Thank you.
And Marcus Osbourne, a former Senior Vice President at Walmart Health. Welcome, Marcus. And immediately to my left is Kimberly Switlick-Prose, Vice President of Enterprise Star Performance at Elevance Health. Welcome to you all.
Thank you.
Let's kick off. The topic, as all of you know, is a new kind of thinking using retail strategies to elevate the member experience. So we're going to talk a lot about some of those forces that even Dan was talking about in the conclusion of his remarks today, about some of those forces that genuinely do drive individual behavior, and how those types of forces have come over the course of the last decade in particular to influence the experience for members of health plans and in the healthcare space more broadly. So I'm going to just start out with a question sort of tailored or specific to each of you, just by way of introduction, if you don't mind. So, Liz, let's start with you on the end. First and foremost, why do you care? This is going to sound like a cynical question, but why do you care so much about the member experience?
So for me, I've been in healthcare now about 25 years, and I think it's such a personal interaction. And for virtually everyone here, I'm sure we've all had our own immediate interactions or caring for our families and friends. And I'm suspecting many of you have gone through the process of, wow, I know who to call and where to go, and it's really confusing for me. And how is it for the rest of the population? So for me, I've really been trying to focus on how do we help consumers gain the right access to care, but also figure out how to navigate a very complex system, which just becomes more complex on a regular basis.
Thank you for that. Marcus, let's turn to you. Joining us from the nation's largest retailer, or coming from that experience, my question for you is, what are there are retailers, and then there are retailers like Amazon, like Walmart. How has the Amazon effect, the Walmart effect in particular, changed retail expectations and by extension the health plan member experience, in your opinion?
Yeah, I think the biggest thing that has occurred in the retail side, and I think that has influenced the healthcare side, is if you look at what retailers have done, the battle that is actually occurring in the market. I think it is one in which you have groups who are attempting to deliver a solution to consumers. They're trying to get them to steer their money, to Walmart or Amazon, and not, and that in that battle, what they recognized was the way to get the most consumer money was to serve the consumer the way they wanted to be served. And that the answer to that was fundamentally not about a single channel. It wasn't about bricks and mortar stores. It wasn't about building a great website or e-commerce site. It wasn't about creating a great mobile experience. It was actually about all of those and how you integrate them into what we now call the omni-channel world, and creating these omni-channel experiences where I want to be served, how I want to be served in that moment. Yes, I want, and the example that I sort of use is an example that sort of hit close to home here for one of the big retailers that are based in Minneapolis, and I actually don't mean Target, I actually mean Best Buy. There's this sort of story that came out in the local newspaper where one of the chief merchants of one of the big retailers was bemoaning this situation where customers were coming into their bricks and mortar retail settings to come look at TVs, and they were coming in and touching these TVs, but then would pull out their iPhone and would like go on Amazon and find that same TV and buy it and ship it to their home. And they were really angry about how their stores were just being used as these sort of shopping fronts, but then the purchase was occurring somewhere else. And what was more interesting was the next day, another chief merchandising officer responded and said, "You're a fool. You should be glad that that customer at least was still walking in your store." And what it showed is that customer, what they wanted is, this was a big purchase. They were going to buy this TV. They needed to see it and touch it, but they wanted best price. Maybe they drove a Mazda Miata. Maybe they couldn't fit that 70-inch TV in their Mazda Miata, and so they needed it shipped to home. And maybe they wanted somebody to install it for them, and they wanted that all done in an integrated, simple way. So that's the battle. You think about that experience from a consumer perspective, and that omni-channel reality that is now coming to define retail. I think that's bleeding into healthcare, and particularly, I think that's a challenge that many health plans are having to deal with, which is, are you building that omni-channel experience that allows people to be served the way they want to be served, not the way that you want to serve them, the way they want to be served? And I think those changing expectations that are coming from retail, that you're seeing coming from financial services and others, I think there are many, frankly, who hoped in healthcare that they wouldn't bleed over, but you can't stop it, right?
Right.
Because people ask, like, if my auto insurer can give me this experience, then why can't you?
Yeah.
And I think that reality is something that now we're all going to face.
Well, and let's stick on that for just a second here, because Kimberly, this is something that you and I were just talking about before we came on. The member experience, and primarily as all of us in this room have a stake in the healthcare space, we're also consumers of it. And so what's it like for you to be a member? You are self-described, as we talked over here at Elevance, the throat to choke, where it is related to stars in Medicare Advantage. But obviously we're all members of health plans. We're all consumers of healthcare. What's it like for you to be a member?
I love this question. So I think of member experience. I think it's important to distinguish member experience as an emotional response, right, to a direct or indirect interaction with the whole health ecosystem. Not just an app, not just the store, not just your clinician, not just your EOB, or somebody calling you on the phone. Like, it really is an emotional response. And as a plan, we've been really trying to focus on, what is that emotional response that we want our members to experience with, throughout their journey, feeling empowered, heard, known, right? So you can kind of know our members, engaged and delighted. And so as I think about my own experience, I had a situation, I was talking about this at breakfast actually, where, I work in the health plan industry. My oldest child had an injury. He broke his wrist, but we didn't really know what was going on. A physician came over to me. He's like a father that happened to be a physician. And he's like, "I'm pretty sure it's broken, but you need to go, you need to go get this checked. Do you know where to go, or do you know what your health plan will cover?" And I didn't know. And I work in the health plan industry. It was a situation where I was not empowered with what the information was that I needed. I didn't necessarily know where to look. I will say I was not employed by Elevance, so it was a previous employer who shall not be named. But I was not empowered, right? I did not know where to go. And it was a really just eye-opening experience to kind of feel as a consumer of the health industry and the experience, right? It's not just about the experience and going into the clinician or buying your product. It's really, do I feel empowered? Do I feel known? Do I feel heard? Do I feel engaged? And do I feel delighted? And as an industry, we do a horrible job of that, so.
I don't disagree. And it's the conversation I think we had when we met as a group was that primarily one of the drawbacks to the relationship, or at least the brand relationship between health plans and members, is often that sort of the experience that you just described, which is that for the most part, members don't have a relationship with their health insurer, with their health plan, until something goes wrong, more primarily related to the fact that members don't have a relationship with a health plan until they bump into utilization management criteria. That's one of the things that I think is unique about the healthcare, the health insurance industry. But what I'm interested in is, and this is for the panel writ large, is what are the similarities and differences between somebody's experience as a retail consumer compared to the experience that they have, in your view, as a member of your health plan? Let's start back on the end with you, Liz.
I just say it's more fun to shop for things that you want to buy, right? I mean, than figuring out what doctor do I need to go to, what procedure do I need. So I think in general, when you're shopping for a car or, even home goods or things like that, it's just a lot more entertaining and fun to do. I think that the retailers have made things much more simple, right? It's very easy to get the products that you need delivered in the way that you're looking for, the support. A lot of patients don't think about the health plan as someone to reach out to. I have had so many friends over the last several years, they'll reach out, they'll tell me about something that's going on with either themselves personally or a family member or a friend, and my first question is always, who's their health plan? And I've had some friends push back, they're like, why does that matter? It doesn't, who cares? And I'll say, but the health plans do have support and programs and other things that will help you. And typically the response is, well, they just want me to go to the cheapest doctor, right? They're not really going to help me out. And so I think that there's still sort of this branding issue that health plans have. People still think it's the 1990s where they were trying to just reduce claim costs. I do think payers are doing a lot right now to make sure that patients get what they need. But the one thing I would add, though, too, is it's very hard to figure out what consumers want, though, too, because it's going to change. There's a lot of digital apps. Digital apps may work in some situations for some people, but not all the time. Some patients want to have support in their handheld. Others just want to text someone, get in and get out, and they're done. So it's a very subjective type of an experience. And so that's what I think we have to really be thinking about. How can you provide a plethora of options in a very efficient way, which enables the individual patient or their family to engage in a way that's very comfortable for them.
And Kim, I want to turn to you for just a second here. And we've talked a little bit already about what as health plans we're doing wrong, right? Or the places where we could do better in the healthcare space. What are some of the places where, or the key takeaways, where you're seeing what retailers are doing from which the health insurance industry has taken the right page out of that book? Where are you seeing those successes happen?
So I'll start kind of building off of Liz, because I think she said something that's just really, really important. With some of these other brands and retailers, there's a trust. Like when you go into a Walmart, when you go into a Target, you know what to expect. There's a trust with not just that you can get what you need there, but there's a trust in the brand. As a health plan, as you think about, we all work in the health industry. When you think about the financial kind of ecosystem within which we operate, and you think about what is the stakeholder that has the most financial interest in people being healthy, it is the health plan. And as a consumer, who thinks about their health plan first in terms of the trust that I trust their intentions with my health. And I think that's just an important, so what we've been really trying to do is, how do we truly become then the trusted partner? It's not happening successfully across the board, as we all know, because who thinks first when they get sick that they call their health plan? It's not the trusted source. But where we are finding more innovations and opportunities to kind of build that trust is actually meeting members where they're at, demonstrating that we actually know them before they actually need us, right? So whether it's community-based events, which I know are think what you will about community-based events, but kind of getting the brand out there, not just from the sense of utilization management or your EOBs and their financials, but really thinking about the preventative services, food, transportation, some of the determinants of health, and really becoming that brand, a trusted brand that is focused on the wellness rather than the absence of illness. And I think that's where we're really trying to innovate is how do we think about the brand recognition from a trust perspective, that we genuinely care about your health and your wellness.
Yeah. And Marcus, you bring a unique perspective to this particular panel, given your background with Walmart. And what the social determinants of health component, I am told from a former colleague of mine that you have an interesting experience at Walmart with apples and bananas, and basically touching on some of the components that even Dan was talking about social determinants of health, the accessibility of healthy foods in an otherwise sea of unhealthy options, and that there was some work that you did back in the day that informs sort of that very topic.
Well, yeah, and I think it goes, and maybe I'll kind of also touch on the kind of earlier question, because you were asking about where is the retail consumer and the plan member the same, and they are the same, right? As a consumer in retail and a plan member, I don't actually change who I am fundamentally, and so at the core, and I will say this is, I'm speaking about the American consumer right now, but I will tell you most of the data I've seen globally would indicate that it may be universal. But fundamentally what we know is it doesn't matter whether it's about healthcare or retail, the situations that generate the greatest angst and concern amongst consumers are when they are sort of put in a place where they don't think they can afford something they need. So it is around cost. Second, where they can't access what they need, where there's a challenge of convenience, and where, as Liz mentioned, where something was inherently more complex than it needed to be. But so if you can help make things affordable, convenient, and simple, you win. And I think the reality in that is it doesn't matter whether that's retail, it doesn't matter whether you're running a health plan. If you are successful in doing that, and in the eyes of the people you serve, you will dominate, frankly. But to your point, I think then what we learn in that is going back to this affordability, accessibility, and simplicity kind of construct is this kind of challenge of everybody talking about, well, how do we get people to do things, do healthy, act healthier. And what my experience at Walmart and what I kind of learned through it is that there are really kind of two things. One is if you actually use that construct of affordability, accessibility, and simplicity, people will tend to do the things that the right things. And that was the example you were using. I think most people were always amazed to know that if you base on number of units sold in a given day or week or year, the number one most sold item in Walmart, it isn't actually sugar water, it is not salty snacks, it's bananas. But the interesting one was through an exercise that was not intended to be a healthy behavior exercise, it was just intended to be a very kind of a normal exercise in Walmart, where Walmart realized, hey, let's go directly and source apples from the growers, and we're going to bypass the middlemen, and we're going to buy all the apples that all the growers, these certain growers in Washington State have, and we're going to take the ones that are a little beat up, and those are going to become applesauce and apple juice, and the ones that look really great will be the ones that we actually sell you whole in the store. The upside to it is the average, when you source directly and you buy all of it, you manage the supply chain, the price dropped in half. Well, guess what happened? Apples went from the 10th most sold to the second most sold item in the store. Why was that? Because the price was cheaper. When we made the price cheaper, people bought more of them, and presumably ate them, right? And so we saw a lot of that. But I think the other thing, and you talked about SDOH that I don't want to miss, was that we also understand that there's this term that I've used, which I actually sort of redefined SDOH as, I call it the social realities that we face. And that what we know is that when we're dealing with a certain set of social realities, those social realities will often get in the way of us doing what the system considers to be the right thing. And the example that I use is, the data that I had seen is that the second you become a caregiver for an aging parent, if you answer this next, if you're now caring for an aging parent and you're asked the question, do you feel like you're doing a good job and you're in control of that experience? If you answer no, then your healthcare costs are going to be 3 to 4x over the next 12 months, or 24 months. But if you actually say, yeah, I actually do feel like I can control it, I've got it, your costs are functionally the same as somebody who's not caring for an aging parent. And so what it taught us was there are these social realities, caregiving or food insecurity or whatever it might be, or that systemically you've got to actually come in and figure out how you can provide support and address, because if you can do that, then it also increases the probability that the things that the good things you want people to do, they're going to be in a better position to do it. Right. And I think that's a learning that we learned that certainly in retail. which is why you see sort of retailers investing at times in very strange programs, and you're like, why would they do it? Because they know those are social realities that might get in the way of you actually coming and shopping. But I think increasingly, what I will tell you from my experience is the healthcare industry as a whole has been a little slower on that, in understanding that.
Well, let's stay on that, and let me ask, the bookends here who are still, actively engaged in the health space, beyond retail, right, or informing retail practices into the healthcare space. Talk a little bit about your experiences with the way that the plans with whom you've worked, the areas that you occupy now is that your experience that health plans have been slower on the uptake than other parts of the industry with respect to these retail practices?
I'd say they're dabbling, and a lot of it is experimentation. Health plans by nature are very risk averse, right? And in the court of public opinion, a health plan will lose every single time, right? If they're going up against a patient or a provider. And so I think the misconception about health plans is they're just totally resistant to change, but actually they're just trying to manage the risk. Because if they implement something and someone goes and can't get their prescription filled at the pharmacy, right? Or can't get something covered that is immediate or life-threatening, that's a big challenge. And so health plans take a long time to make decisions because they're very deliberate in how they're approaching things. And I think that's something too. So it looks like really slow progress, but once they get on board with things, they're willing to jump in. I think with things around, food, housing, transportation, and securities, a lot more things are happening because they're recognizing the realities of people needing to choose between prescription drugs or healthy food, right? And that shouldn't have to be a choice. So how do we figure out how to support that? Or if you have a child with asthma and you're providing inhalers, but they live in a home that's infested with mold and dust, there's only so much you can do. So how do you help in different ways? But I think it's just that reality of they're very broad populations that are very diverse. And how do you figure out ways to solve it as efficiently as possible without creating adverse disruption?
Right.
I completely agree. I think that was really well said. I also, I think we've lagged in really appreciating kind of the upstream of health, right? Like, everybody has a journey, a morbidity journey, right? As as Dan eloquently said this morning, right, in terms of our, the environment in which we're working or living, and how much that actually influences our health. And I think plans have finally embraced just even the concept of determinants of health. I mean, we were, again, talking this morning about, my background's public health. Public health people have been talking about social determinants of health for decades and decades and decades, right? And health plans, I think, are finally realizing the financial value of really addressing that upstream and the determinants of health to support members where they're at with what they need to actually be healthy. And I do think we're making more progress, but it's lagged the industry, or lagged just, retail in particular. One thing I want to pick up, though, that Marcus mentioned, which I also think is really important in terms of the health industry and health plans and retail, is it goes back to that concept of empowerment, right? So when you go into Best Buy or Amazon to look at a TV, you're empowered with the information of how much things actually cost. Right. So you can make you're empowered with that, you can make an informed choice. Similar with a caregiver. Like a caregiver, if they're empowered with where to go, how to access information, how much things are gonna cost, they will be, the behaviors will follow in terms of kind of desired behaviors, if you will, from a health plan perspective. The health industry, like, who knows how much their doctor costs. If you go to, Dr. Marcus versus Dr. Cory, like, nobody knows. And that's a lagging function and capability, I think, within our industry as well. Now that is changing, but it's changing slowly, right? I mean, a lot of, CMS is putting in policies for transparency of cost. A lot, Elevance is investing quite a bit on financial estimates, as a lot of plans are, so that people have that data point as well to feel empowered to make a choice. But it's, that's a huge lag, I think, in terms of retail and the experience of a retail, and then how you build that trust of a brand that health plans we're not at that maturity.
Right. I see by the clock at our feet, we've got about a minute left in this. So let's go sort of rapid fire round robin, because I think I really like, Kimberly, the subject that you just introduced, which is the stuff that health plans can do, and essentially what is changing about the way that the health space. In your experience, what are the most important things or thing that in this space we're starting to take a look at that is going to have a fill in a missing gap for member experience?
I don't know if it's the number one, but the one that's popping in my head right now is actually demonstrating, well, not just demonstrating, actually using the data that we have to know our members, to then design intentionally for what they value and what they need to support their journey. Health plans have two assets. We have people and we have data. And I think health plans are figuring out how to use that data better, like retailers have, to actually personalize the experience that will build the trust to kind of nudge the next, the desired behavior.
Marcus?
I agree completely with that point. I'd also say I think the focus shifting from your role isn't just to provide health support, it's social support. I think this idea that you've got to go upstream on some things, and that spending a dollar here will actually impact medical spend down there. I think that's understanding that connectivity and understanding that kind of investment in the broader social support that we're now starting to see that movement around, I think is transformative.
Right on.
I'd agree with both. I would just add transitioning care to the home and the community, right? And meeting people where they are, where they live, and where they work. A stat that has always stuck with me is, it came from a former Kaiser physician who said, even your most high-cost chronic patients spend no more than 900 minutes a year with their physician in the exam room. That's not much when you calculate time throughout the duration of a calendar year. And so how do you really think about meeting people where they are and making it more convenient? And if you have someone who is battling multiple comorbidities, getting them in the car or transporting them to a clinic visit or a hospital can be really challenging. But if you can have other resources that can address maybe emerging needs through remote patient monitoring or other sorts of insights, they're engaging that patient multiple times a week without having to move them out of that home setting. I think there's a lot of opportunities for that too.
Thank you for that. I don't know about you guys, but that was the fastest 30 minutes I've experienced in a long time. That concludes the formal panel portion. Let's give a round of applause, please, for our panelists. I'd like to move now to a little Q&A, if all of you are open to it, because I'm not the arbiter of all questions. I don't want to make believe that I'm the one asking all the good questions. I'm sure that there are lots and lots of smart people out in the audience who have questions as well. So if you would like to ask a question of anyone on the panel, please throw up a hand. Let's make sure we'll get a mic over to you so that everyone can hear your question. We can capture it for posterity. For those of you who might be mic shy, that might terrify you, but we'd like to hear the questions that everyone has. I see one over here.
Hello, thank you so much for that. That was really insightful. I had some questions on what retail strategies or programs have you seen work to improve the member experience in healthcare?
Well, I think it was actually one that sort of comes to mind that I was really fixated on was this idea of finding opportunities there's so much innovation occurring, but the way that sometimes that innovation is deployed, it gets deployed in a very kind of traditional care delivery way. And the example that in my mind is I think about all these kind of diagnostic and assessment innovations and tools that are coming out, but that typically the only way that you would ever be able to interact with them is if you went to the doctor, you went to your primary care doc, or went to the hospital, which we've just acknowledged that even the sickest of us are only going to be there rather infrequently, and that most of us are only going to go once or twice a year. And so I think what I actually had seen is, which was interesting, is this. Often it gets misread if you look at how few people go and do a health assessment in a given year, or go, do any kind of get any test run in a given year. It's always sort of read as, well, Americans aren't interested in their health and assessing their health. But we sort of described, when I was at Walmart, we launched a program called Walmart Wellness Days, which were these free kind of screening events that we just did in the stores. And as I would say, I can now say kind of, I didn't think they were actually particularly well executed. There were some folding tables with a little cloth over it, and there's some random stuff on it. So they could have been done way better, but yet in a 4-hour period across 4,000 stores on a Saturday, you would see over 400,000 people in America come do a full health assessment, meaning they were getting biometrics done, they were getting cholesterol tests, glucose tests, A1C tests. Half of those people would tell you they hadn't had those tests or screenings done in over 5 years, and a reasonable percentage had never had it done. So what it told me was, it's not people weren't interested, it's just they didn't want to do it the way that the system was sort of delivering it. And so I think so whether it was things like Walmart Wellness Day, or it was Higgy kiosks or Pursuant kiosks, where we saw more people were doing health risk assessments on those kiosks than were doing them in the traditional system in a given year. What it just told us is we've got to find novel ways to unlock some of this innovation and deliver it in different ways to allow people to use it, interact with it, engage with it. And I think that's true not just for diagnostic, but you mentioned the digital health solutions that are emerging, and there's just a range of really kind of compelling innovation that's out there. But I think too often we just jam it into a very traditional care delivery approach, and then we're amazed that nobody uses it. And so I think that's the one thing I think hopefully that retail is influencing the broader healthcare industry, is to say, no, you can find very different ways. And as bad as the COVID pandemic was, I think it also, frankly, forced everybody to act in a innovative, and to be more innovative and be open to new approaches. And it showed us that there are really kind of interesting, creative ways to engage people in their care, and that they will engage. And so I'm hopeful that sort of influencing still continues.
I would add advocacy. And I think, when you walk into a store, you're going to have salespeople, you're going to have greeters, because if you go into the store for the first time, I don't know where the soap is versus the shampoo versus the food, right? So I need someone to ask. And what I've seen emerge that I think is really very exciting is this idea of advocates. So most patients don't interact with the healthcare system that frequently. Commercial, you may have 50, 60% of your population, that doesn't interact at all. They may just pick up prescription drugs on a regular basis. So when they do need to interact, it's sort of like walking into that giant store for the first time and not knowing where to go. Or you have someone who's been diagnosed with a chronic or catastrophic illness, they're exceptionally vulnerable, right? And the last thing they want to do is go read a 40-page benefit summary and search through a provider directory to figure out what to do. So I'm really enthusiastic about the new kind of era of advocates who will provide insights, guidance, support to patients, give them evidence-based guidelines, but not in clinical speak, in a list of simple questions that they can ask to their physician. They can have a real dialogue. They can get the information that they need. There's several that I've spoken to over the last several years, and I always ask, how do the physicians respond? And they've all said, there was one CEO of a company who was 25 years in the making, and he said, I can count on one hand the number of physicians that have called to complain. The majority of them called to say, can I get copies of what you just gave to my patient coming in? Because it was actually one of the best conversations I've had. And I finally felt that patient understood what I was saying. So I think it's that ability to give them the support, but personalize it to what the needs are, and then make sure that they can get access to those resources outside of the interaction with the traditional system.
I love that. A couple things I would add, and things that Elevance are doing is, Elevance Health. For those that don't know, Anthem just rebranded to Elevance Health, and it's Elevance.
And we're all getting used to it.
Yeah, we're all getting used to it, thank you. Is two things. One is supplemental benefits and the ease of accessing supplemental benefits through a digital application. So for example, supplemental benefits, especially in the Medicare space, is really moving much more towards like over-the-counter products and meds and diagnostics that are in home, food, transportation, the ability to access and purchase those things through a digital app, such as like your website if you go to Target, is making it easier to then utilize your supplemental benefits and get the products that you need just delivered to your home, rather than having to kind of figure out how to use it and access it and then go somewhere else and submit a receipt into your HSA or whatever the case might be. So that's one area where, retail strategies, I think, are, again, finally kind of making their way into the health plan space. The other, and COVID, I think, is horrible in a lot of ways, and it accelerated the use of virtual care. 2 years ago, 2.5 years ago, providers didn't feel comfortable using or delivering care through telehealth or virtual options. Members were not used to it or comfortable with it, and COVID kind of forced that as a innovation, if you will. It's innovation to the health industry. It's not innovation across the spectrum of all industries, but I think that's another area that we're continuing to see grow. I mean, it's convenient, it's lower cost. The quality is similar, if not even better, because of the experience that members can have through that kind of interaction. So that's another area that I think is continuing to expand, and I think will continue to expand.
Other questions from the audience? I don't see any hands going up. So I had one that I wanted to pick on. Liz, you prompted this when you mentioned the, not in clinical language. And I wanted to stay on the subject of language for just, one more minute. Because retail has language figured out, full stop, right? And I'm interested if there are other thoughts that you have related to the topic of language, retail, the success of language in retail, and how it can and should apply to healthcare. And I'm not talking necessarily about strict translation, although that too, right? So culturally sensitive or appreciative types of translations, but not just translating from one language to another, but the use of language in a consumer context that is meant to make things more approachable.
I'll just say, so I've spent 15 years in the 2 largest health plans. We're horrible at this. We sit around a room and we rewrite things and we go, wow, we took that benefit summary from 40 pages to 35 pages. We've totally simplified it. It makes no sense to the average person. And a couple of things that I've seen done is bringing in literally teachers who are 5th grade and 8th grade level to have them come and review materials so that it becomes digestible for the average person, because we are consumers of healthcare, but we are not representative consumers. We think about plan designs, network constructs, clinical programs, maybe not all day, every day. The average person doesn't think about this unless they're in the midst of some sort of interaction. And I think really getting it to a point where I would always say to people on my team, how would you explain it to your mother or your father? Not that your mother and your father are not smart people, but just they do not interact with the system. So how would you explain your job or the program you're working on to your mom and dad so that they could get it and they could even explain it to their friends, right? I think that's the challenge, but it's been kept at such a high, complex level for so long that in the industry we've sort of just accepted it. And I think we really need to make a change and get it down to that level so that the average consumer can really understand it.
Yeah, and I'd maybe say 2 things. I think one is, I'll add to that, just a sort of translation. There was a story, kind of early in my career, but I was visiting a clinic provider that was in one of the early days of the retail clinics in Mississippi. And this place was absolutely crushing it. And I had visited a lot of retail clinics, and they were not crushing it. They were not barely seeing anybody show up. And this place was seeing 30 or 40 people a day, which is extraordinary. I'm like, what are you doing? And then I had doctors with me, and on the sign, on their little pricing sign, it said, we treat for sugar. And the guy was like, what in the hell does that mean, right? Like, and then lo and behold, we talked to the nurse practitioner. She's like, yeah, everybody's coming in for the sugar. And he's like, what? Like, what? And didn't realize that we're talking about diabetes. And so part of it, I think, is that the the language that we all use to describe our own sort of health conditions are not what doctors and the industry, or it's a different language, and so I think there is a need for that. But I also think there's another piece that I don't want to miss in language. Language is it is words are what you use to make people feel invited and comfortable. And one of the interesting things when we launched Walmart Health, which we stole from the basis for it, we stole from Chick-fil-A of all places, was we wanted everybody that walked in the door to be greeted, and we were very clear, like, let's test different language, but we're like, thank you for coming in today. Thank you for allowing us the opportunity to see you. And we're like, just tell everybody who comes in the door that. We tested it, and what I will tell you is the people that in places we didn't do that out of the gate versus the places we did, the people that we did that with, the probability they came back and visited us in that same center was like 30 or 40x higher. I mean, it was, and so what we found is, it kind of sounds strange, but like the healthcare industry, and particularly healthcare providers, don't sort of act like they're grateful for the people, the patients and the customers and the consumers that have come visit them. And if you actually tell people, like, I really thank you so much for coming in, it was really an honor, and like, you use those words, you do what Chick-fil-A does every time that they say, how can I serve you, how can I be helpful? That language matters. Yes. And that I think often it's small things like that, but if we, I think, invest more in things, understand that what your comment was, that language does matter, that it can have a profound impact.
Yeah, it's the delight factor.
It is, absolutely.
Right? I mean, the difference between a Chick-fil-A and a Culver's is the delight of that welcome greeter.
Right. That's right.
One of the things that we've really, and it builds on a little bit on both of what Marcus and Liz have said, is, there's a difference between health literacy and health insurance literacy, right? And I think as an industry, we sometimes conflate them. But health, I'm assuming a lot of us, but maybe not, like, know the difference between a cost share, copay, deductible. But like, those are really complex concepts to really understand when you're making a choice. And so, a lot of that 8th grade or 5th grade language is so important. It's like, how would you explain it to a 5th grader? And how do you test it with your consumers? Yep. Do they actually understand it? Are they getting out of it what you need to really feel health insurance literate? And then that's also a gateway, I think, to that trust, right? If I'm helping you understand something, like, so that you truly understand it, not just checking a box, it goes a long way to then building trust. And then similar with health literacy too, right? I mean, do people really, like, are we speaking the language that people use in their communities to describe whatever their health conditions are in a way that makes sense and resonates? And so to me, that's a huge opportunity also as an industry.
Great. That is the time that we have. A very special thank you to our panelists, Liz Canis, Marcus Osbourne, and Kimberly Switlick. I struggle.
It's a lot of letters. It's phonetic, but it's a lot of letters.
I said I was going to get it.
It's
Kimberly,
all right.
Switlick-Prose. So please join me in thanking them for their time.
Thank you.
Thank you all.
Thank you.